Welcome. I am Terry Tropin, and today I'm presenting a lesson on ICD-10-CM coding using the table of drugs and chemicals to code poisoning, adverse effects, toxic effects, and underdosing. Let me start with information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA, RHIA and CCSP certifications. Also, I am an AHEMA approved ICD-10 trainer. I have taught health information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, ICD-10-CM, ICD-10-PCS, and external causes. These are available on Amazon. This is a partial copy of the table of drugs and chemicals, showing the headings at the top of the table. The table is found in your ICD-10-CM book between the neoplasm table and the external cause index. On the left-hand side of the page, here, is an alphabetic list of drugs and other substances. Then there are columns for poisoning, adverse effects, and underdosing. Note that there are 4 subcolumns under poisoning, which indicate the intent of the poisoning. Was it an accident? Was it intentional, such as a suicide attempt? Was it an assault, where someone tried to harm the patient? Or was it undetermined? Undetermined is used only when the physician specifically specifies the documentation is undetermined. The intent is undetermined. If the intent is unknown or unspecified, use the column for accidental. Here's a summary of the overall guidelines. Use as many codes as needed to describe what happened in a specific case. This may include several different drugs or substances, several different side effects, or other conditions related to the drug or interactions of several drugs. If the patient experienced more than one reaction to a single drug, code the drug once and then each adverse reaction or side effect or reaction to poisoning. If the patient experienced reactions to more than one drug, code each drug separately and then each adverse reaction. So each drug and then each adverse reaction. The guidelines also state that external cause codes do not need to be used with these codes. Note the citation at the bottom of the slide. This is the location of the guidelines in the official ICD-10-CM guidelines. The citations are listed on slides throughout this presentation as needed. In the tabular list, poisoning, adverse effects, and underdosing codes are grouped together in T36 to T50. For example, inhaled anesthetics, T41.0X. So if it's accidental poisoning, it's a 1 digit. If it's intentional, it's a 2. If it's an assault, it's a 3. Undetermined, it's a 4. So these are all for poisoning. For adverse effects, T41.0X5. For underdosing, T41.0X6. And remember that these codes require a 7th digit. Initial encounter, an A, subsequent encounter, D, a sequelae, S. Toxic effects, on the other hand, are listed in a separate section, T51 to T65. For example, T51.3X, toxic effect of fusel oil. So if it's accidental, it's a 1. If it's intentional, it's a 2. If it's an assault, it's a 3. And if it's undetermined, it's a 4. So all of these are toxic effects. And these also require that 7th digit for initial or subsequent encounter or sequelae. So how do you determine the correct code? Here are the questions you need to ask. Which column should you use in the table of drugs and chemicals? What if there's no entry in the table? And what other codes might be needed? Let's start with poisoning. In a poisoning, something was done wrong. For example, there was a mistake made in the drug prescription. Could be made by the provider, could be made by a nurse, could be made by the patient, another person like a pharmacist, doesn't matter. Something was done wrong. An overdose was taken or given intentionally. Non-prescription drug taken with correctly prescribed and properly administered drug. So a patient was taking a drug, taking it as directed, but also took a non-prescription drug, an over-the-counter drug, and they interacted adversely. It also could be a prescribed drug used with alcohol. Many drugs say don't use this with, do not drink when taking this drug. If the patient drinks and takes the drug, that is a poisoning. Poisoning codes are used in some cases also for street drugs, cocaine, heroin. So if it's a street drug taken resulting in an overdose, you refer to that as a poisoning. You code that as a poisoning. Street drugs taken with a prescribed or over-the-counter drug, that's a poisoning. Over-the-counter drug taken with a prescription drug is a poisoning. Two over-the-counter drugs used together can have an adverse reaction in the patient, and that is also a poisoning. It is considered a poisoning if the patient has an acute condition resulting from drug dependence or abuse. It is not considered a poisoning if the patient has a chronic condition resulting from drug abuse or dependence. An example of that is the patient has long-term use of cocaine, and because of that, they have depression. That's not coded as a poisoning. Codes for poisoning, T36 to T50, include a 6-digit for the intent, accidental, intentional, assault, and undetermined. And as we said, it also includes a 7th digit for the encounter. The coding guidelines state that the code for the poisoning is listed first, followed by a manifestation of the poisoning, the condition resulting from the poisoning. If needed to complete the story, you can use more than one poisoning code and more than one code for the manifestation. Remember the guideline, one drug, multiple manifestation, you only do the code for the poisoning one time. So here's a practice. If you wish, listen to the case and then pause the video and code this on your own. A patient combined prescription Percodan with taken as directed with beer and became stuporous and drowsy. Stuporous is kind of like brain fog and confusion. So if you code the poisoning T40.2X1A Percodan and then T51.0X1A for the beer, these can be in any order, but you list these first and then do the codes for the symptoms. Now let's move on to toxic effects. This is defined as a reaction to a non-medicinal substance such as arsenic, black widow, spider venom, pesticides. These substances will never be used in a prescription. For example, carbon monoxide poisoning is very dangerous, lots of side effects, but no one prescribes carbon monoxide. For toxic effects, you use the same column as you use for poisoning, but as mentioned before, they're in a separate section of the tabular list. So compare toxic effects and poisoning. Toxic effects are due to substances that are not medicines that cause problems. Poisonings are medicines that cause problems. So toxic effect codes from T51, T65 are listed first, followed by a code for the manifestation. This is the same sequencing rules as used for poisoning. Here's another practice. Again, pause the video if you wish to code this yourself. Patient accidentally ingested the bug repellent DEET. She is experiencing vomiting and nausea. This is the initial encounter. So this is the toxic effect, since obviously there's no medical use for DEET. So go to the table of drugs, find DEET, poisoning, you'll find T60.8XA, X1. You'll need a final digit A to indicate initial encounter. Then in the alphabetic index, find vomiting with nausea, which refers you to R11.2. Remember, the poisoning toxic effect code goes first. Let's move on to adverse effects. Adverse effects occur when medications are correctly prescribed, properly administered, and yet the patient has a side effect or reaction. Everything was done correctly, but they had an adverse reaction. Remember, poisonings where something was done wrong. And adverse effects, everything was done right, but there's still a problem. Here's some of the examples of conditions that may be due to an adverse effect to a drug. The drug was taken as prescribed, but the patient had a reaction to it. Tachycardia, delirium, vomiting, renal failure. So they can be minor or they can be obviously quite severe. Sequencing for these codes is different. For adverse effects, the manifestation is listed first, followed by the code for the adverse effect. Remember, the poisoning and toxic effect codes were listed first, followed by the manifestation. So this is the opposite for adverse effects. So here's another practice. Again, pause the video if you wish. Patient took his medication, Benadryl, as directed for his allergies. However, he suffered drowsiness and dry mouth as a side effect of the medication. This is the initial encounter. So this is a adverse effect. So you start with the effect first, and then the adverse effect code. So R40.0, R68.2 for the dry mouth and the drowsiness either can be listed first, and then the T45.0X5A for the adverse effect. We went to the table of drugs and found Benadryl and used the column for adverse effects. Now let's move on to underdosing. Patient took less of the medication than was prescribed by the provider or the manufacturer's instructions. So why would they do that? Well, a patient may take less because it's too expensive. Patient may take less than prescribed because they get confused as to how much they're supposed to take. Or sometimes the patient will say, hey, I'm feeling better, I'm going to stop this, I'm not going to complete all of the drug prescribed. In which case the condition often returns. So sequencing for underdosing is the same for adverse effects. List the manifestation first and then the underdosing. Remember that for poisoning toxic effects, the poisoning code is listed first. For underdosing and adverse effects, the manifestation is listed first. Here's another practice. Patient had uncontrolled hypertension. She'd been taking lisinopril, but found she could not afford it. She was taking half a pill a day instead of a whole pill to kind of stretch it out a little bit. This is a subsequent visit. So first you do the uncontrolled hypertension, I-10. That's all the information we have. Then you do the T46.4X6D for the lisinopril. using the column for underdosing. The final digit D is used since this is a subsequent visit. You might also use intentional underdosing. The patient did this on purpose because she couldn't afford it. And that's a Z code. We'll talk more about other possible Z codes in a few minutes. Okay, what if there is no entry in the table? This might be because the specific drug is not listed, the specific drug is not documented by the patient, or it's a toxic effect that is listed in the alphabetic index instead of the table of drugs. What if there is no entry? If a specific drug is not listed or not documented, look for why the drug is being given. If it's a drug that is being given as to treat nausea, you can find in the table of drugs anti-nausea drug. If it's done for cancer, like chemotherapy, you can look up anti-neoplastic agent. So if you don't find it in the table, sometimes you can go to these entries in the A section of the table of drugs and find it there. It's anti-cancer, anticonvulsant, so the reason the drug is being given. Another time when you might find that there's no entry in the drugs or chemicals is for toxic effects. Anaphylactic shock, food poisoning, allergies. These are looked up in the alphabetic index, not the table. You can look up shock, anaphylactic, poisoning food, or allergy. So here's the final practice. Anaphylactic shock due to ingestion of pecans, initial encounter. So in the index, you look up shock, anaphylactic, due to food, nuts. And T78.05XA is the code you referred to, and that's anaphylactic shock reaction to pecans. What other codes might be needed? Codes in other chapters might refer you back to the table of drugs and chemicals. For example, L53.0 toxic erythema, there's a note under this code stating code first poisoning due to drug or toxin if applicable, and it gives you the codes and the 5th or 6th digit. There's also a note, use additional code for adverse effect to identify the drug, and that refers you also to the table. Notice that this follows the same sequencing rules. Poisoning, it says code first. Adverse effect, it says additional code. So it's following the same coding sequencing guidelines that we had before. There are many Z codes related to poisoning, adverse effects, toxic effects, and underdosing. For example, observation for suicide attempt, allergy status, intentional underdosing, unintentional underdosing, history of suicide attempt, history of poisoning. So these may be used in addition to the other codes we've talked about. There is no way you can remember all the guidelines in the ICD-10-CM book. Here's some suggestions of things you might want to write in your book to help jog your memory. So in the table of drugs, circle the headings for poisoning and then note the subheadings for accidental self-harm, assault. In the columns for poisoning, write in also toxic effects to remind you that poisoning and toxic effects are coded from the same column. You might also look for those terms, the anti-diarrhea, anticonvulsant, etc., and circle those so that you remember that they're there. Now, one of the most important things that you might find in there that look up and not be able to find is chemotherapy. So look where it would be if it was in the table of drugs between chemical substance and NEC and chenodeoxychloric acid, and then write in chemotherapy and refer yourself to the anti-neoplastic entry in the front of the table. So that's in the table of drugs. In the tabular list, under section headings for poisoning by, adverse effects of, and underdosing, T36, T50, circle the codes that says code first, circle the use additional code notes to help you remember the sequencing. You might want to write in the sequencing there too if that works better for you. Under the section of toxic effects, circle the use additional code note there. So sequencing is one of the things that's hard to remember in this section. So help yourself out and write it. Write it in the book. This completes the lesson. If you have questions or comments, please feel free to contact me. If you'd like a copy of these slides, just ask. Here are the books. Here's my contact information right here. Here are my books. They're on Amazon. Got PCS, CM, external cause, and E&M coding. You might just go to Amazon and type Amazon Books and type in my last name, Tropin. Thank you so much for listening. I hope to have more lessons up soon. Thank you.